Hi guys, this is Sabrina and Sarah from HPE East. We are going to focus right now on a training on how to have meds self-administered to the clients and how to document and chart this in kipu. Hi Sarah.
Hello. So one thing to always remember when we're doing medications, it's always observation. It's never you actually physically giving the medications to the client. So when you're in a client's chart, this is what it'll look like. You're going to want to go to the MAR. This is the one where it's going to give you what medications the client's going to take.
Okay.
So once you click there, when it's medications that are scheduled, they show up here. When it's medications that are, if they need it, this is PRN, that's what that means, only if I need it, they show up down here. You always want to watch and see when they're due. If they're due, they show up in like a reddish, pinkish color like this.
Okay.
So since the medication was due at 6:15 in the morning, that's why it's still lit up, because it never got given. These ones are not lit up because it's 2:15 and then at 10:15 this evening, so they would not be giving them right now. If a client's going to come and get this medication, what you always do first is vitals and then CWAs and CALs. The reason you're doing vitals is we need to have a base of where the client's at. Most controlled medications have parameters on the vitals. You can't give it if the blood pressure is too low. So that's one main reason why we take vitals first. Then you're going to do CWAs and CALs and vitals, which will be a different video showing you how to do those two things. After you've done those, we administer meds. When we administer meds, all medications are kept in lockers like this. The lockers will sometimes have names, or they're going to be referred to our board, where our board will have the name with the number correlating to the locker. So you would go into any locker of the client, you would open it up. Here, you should have a picture of the client that proves it's the client's locker, and then their medications will be inside the bin.
So they have their face sheet.
Correct. We have a face sheet on ours. Some, I believe over at Harmony Place, they actually have a picture blown up with their names and date of birth. Mm-hmm. Ours has a face sheet like this client.
Okay.
When we give the medications, we're going to give it to the client. You always double check what it's for. So the medication and the amount. Look at the medication name and the amount. Then you will tell the client, okay, so you're taking only 8 milligrams. 8 milligrams is one of these. You're going to pop out one of them only. You hand it to the client pops it out, grab it back. The client has to put it physically in their mouth. Then you come over and you would mark yes. For meds that need blood pressure, which is every controlled medication, you would write whatever their blood pressure was, and then save status. And save status shows that you observed giving the medication. You didn't physically give it. Once that happens, where this will be where the patient's picture normally is, you click here, and the patient signs that they took their meds, they agree, and submit. So it shows that you observed the medication and the client agreed, yes, they took the medication.
Okay. Thank you.
You're welcome.